is Dr. Behnam. I'm an orthopedic spine surgeon at Spine Solutions. I was influenced to become a doctor through my family. We happen to have a lot of physicians and allied health professionals in my family. So the gravitation towards the field of medicine was a natural one for myself and my twin sister. Specifically, to become a surgeon, I think it would be my uncle, my mother's brother. He is an orthopedic surgeon. He's retired now in California. Growing up as a child, I find myself spending time at my uncle's office. And as I grew older, we spent more time with my uncle, and I'd find myself following him into the hospital on days off, and then eventually getting to go see patients on rounds and becoming familiar with the nurse's station and spending weekends with him. And then when I went into medical school, and as I became a medical student, at times he would let me actually come and say hi to the patients and introduce myself once I registered through the hospitals. And that was a heavy influence on my decision to become a surgeon. I went to college at the University of California, Riverside. I then got a master's degree at Loma Linda in public health. And after that, I went to medical school at the University of New England in Maine. I found that we did a large number of spine cases as a resident, and it just really piqued my interest. I found a love for it, and I found that you can help a lot of people with spinal problems. I tell patients that I wouldn't treat them any differently than I would treat my own family. So my recommendations are made, whether they're surgical or not, based on what I would recommend for my own loved one. And I think that's the fundamental to all my nurse practitioners. They've picked that up through the training, and even my office staff knows that our decisions are made to treat people like family. I think you're going to expect and almost be guaranteed the best results when your philosophy is that. We follow a certain algorithm. It involves therapy, rehabilitation, pain management when necessary, oral anti-inflammatories. Most people are able to avoid any kind of surgery just with that regimen. However, there is a time when surgery is indicated. Once indicated, my philosophy is to explain the surgical procedure to the patient as best as possible. And I personally, and the staff here at Spine Solutions, like to do the least amount of surgery to get the greatest amount of benefit. My success is the patients coming back and referring other patients. Then I know that I'm making people happy. And that happens to be how we see most of our patients now. I typically perform minimally invasive spine procedures. A typical day can run between a microdiscectomy, a less invasive spinal fusion, an anterior cervical disc replacement, a lumbar disc replacement, or something as often as a anterior lumbar interbody fusion. As an orthopedic surgeon, we learn how to do musculoskeletal medicine. We're bone and joint surgeons, so our base core training is in trauma and extremity as well as spine. Over time, surgeons such as myself who chose to subspecialize in spinal surgery will only do spine surgery, such as what I'm doing now. For the immediate and foreseeable future, I just want to be in the community and I want to offer people my services. I don't want to go anywhere. I plan on staying here for a very long time, and I hope to grow with my patient base. Here at Spine Solutions, patients can set up an appointment by just simply calling our telephone number. We also have an email set up called referrals@spinesolutions.com, and they can go online and request an appointment that way.